Hi, I'm Carolyn from Surf Market. Surf Market has proudly served the Sea Ranch community since 1956. We're honored to share a common vision with the Sea Ranch, a deep commitment to environmental stewardship. Through our support of organic farmers, local purveyors, and through our partnership with Sonoma Clean Power, we're doing our part to ensure a brighter future for generations to come. Thank you to the Sea Ranch community for your continued support. We hope to see you soon.
Hi, welcome to This Sea Ranch Life. Today, our guest is Micheline White. Micheline is the executive director of the Mendonoma Health Alliance. Sometimes we refer to that as MHA. And Micheline, thanks for joining us today.
Yeah, thank you for having me. I'm excited to have the opportunity.
Yeah, well, we have a lot to learn. MHA, Mendonoma Health Alliance, has been around for a few years, but I'm pretty sure there's probably a fair number of people who don't know much about you or what you do. Why don't you kick off by telling us a little bit about the MHA mission?
Yeah, so MHA's been around the coast since 2017 officially. There's a 2-year planning period before that to get launched. Mendonoma Health Alliance is focused on expanding access to quality healthcare and prevention services in collaboration with the community. So that's what we focus on, and that's where all of our programs and partnerships are based from, the decisions to do those.
Right. Tell us, expand a little bit more on the founding of MHA. What happened? You weren't there, and then you were there, and was somebody just dreaming of this alliance, or tell us how things really got started?
Yeah, so back in 2015, there was a group of healthcare executives that got together, and that included from Redwood Coast Medical Services, our local clinic, FQHC. It was Santa Rosa Memorial Hospital and Coast Life Support, our EMS ambulance service. And they were working together to identify a few different things. The first was trying to figure out how to bring a small critical access hospital to the community, which ended up being too expensive, so we didn't see that happen. But as the three groups worked together to identify ways they could further their work, they quickly realized that there was not enough administrative capacity to support the projects they wanted to do.
Mm.
So they created Mendonoma Health Alliance as the lead entity of what we refer to as a rural health network. And so Mendonoma Health Alliance launched in 2017 after receiving some federal funding. And since then, we have been doing a number of projects in the community funded by the federal government, and we've added partners along the way and programs along the way. The purpose of the programs is to really support the infrastructure and the patients of those partner organizations.
Okay, wonderful. Tell our viewers a little bit about your own background. I realize I don't know who knows you in the community and who doesn't, but here you are, you're running MHA now, but what have you done? What have you done in your career or your life, and how did you end up here?
Yeah, so I'm from originally Sacramento. I had a pretty rough childhood and upbringing and received many services that helped supported my family and got me basically into where I am in life today, which is kind of why I have a passion for the work I do. There was a lot of addiction in my family. There was, sexual abuse, all kinds of really dark things, low income, homelessness. And I was fortunate enough to receive a lot of support services and had the community essentially wrap their arms around me, which helped me grow and dream of going to college one day. And I did that. I went to Sonoma State, got my bachelor's in sociology, met my husband, and who is Aaron Kirby. He was born and raised here. And so we moved back to the coast. I moved with him in 2008, started as the executive director at Coastal Seniors after a short time writing for the ICO and working at a number of local restaurants, and served as the director at Coastal Seniors for, I think, 5 or 6 years
Okay.
before hearing about the opportunity at MHA. A lot of the skills I have come through drinking through a fire hose to, learning on the spot. I absorb a lot of the information that I learn, and I love to do that. Right now, I'm actually in my last semester as a grad student through the University of Southern California. I'm earning my master's in public health with a focus on community health promotion. So, a lot of the skills that I've learned through this program, I've actually already been implementing for years through Mendonoma Health Alliance, but just honing in on those and getting more opportunities to serve our community with what I'm learning.
Right, so you've come to this position both in your personal younger life growing up, and then through your education, and then your work experience. Coastal Seniors is pretty well known to a lot of folks and doing a lot of important and good work for the seniors in our community. So it seems to me it was kind of a natural transition for you to
Mhm.
to move to MHA. Um, Talk to me a little bit about the kinds of services that MHA provides, and I'm not entirely clear on what services MHA provides as opposed to maybe Redwood Coast Medical Center or Santa Rosa Memorial. How do all the organizations fit together, but specifically, what does MHA do?
Yeah, so surprisingly, we actually don't have really any overlapping services.
Oh, okay.
We will once, we'll probably talk about this in this interview, but Mendonoma Health is launching primary care on a mobile health clinic.
Yeah, well, let's
So
come to that in a little bit. Yeah, for sure.
yeah,
Okay.
but up until then, all of the services have been support services. So basically, we started with a care transitions program, which helps people transition back to our community after a hospital stay. And through that program, we deliver case management. We help people access their medications, transportation to and from follow-up appointments, either locally or out of town. We also help people access durable medical equipment, anything that will really help them stay home, whether that's coordinating home health services that are provided by our CMS or helping people find a caregiver that can stay home with the individual. And then, we see people for a number of things through the Care Transitions program. It could be from COPD all the way to diabetes and addiction related. And so we try to connect those individuals back into our other services. We provide free health screenings for blood pressure, A1C, cholesterol, HIV, hepatitis, and we were doing COVID, but since we now just distribute home tests for that. And what we do with the health screening program is we test people, they're non-diagnostic tests. Once we get the results, we let the person know what they look like and if they need to follow up with a medical provider. And if their results are out of range, we help them coordinate care with their primary care provider or establish care. We do a lot of work with addiction, so we help people navigate addiction treatment services, whether it's inpatient or outpatient. We help them establish insurance if they don't have it. We have a peer recovery group and one-on-one peer recovery sessions for people in recovery or people in active addiction that want to get help. We coordinate case management care for anyone in the community. All these services are free. Case management could be anywhere from navigating cancer treatment all the way to helping your child get their child vaccinations. Basically, we close the loop and the gaps in people being able to access medical services.
Are you a good starting point? Like, let's say I got some kind of medical or health conditions and I don't know exactly what to do up here on the coast. Would I possibly come to you to get some direction and guidance and get channeled into the right place? Is my understanding
Absolutely.
correct? Okay.
Absolutely. Yeah. So we help people, and many other people come to us. we've offered financial assistance in the past after the storm disasters and throughout COVID. So we've distributed over $100,000 directly to our community members who had been impacted by those things. And a lot of times people will come in for just COVID tests or financial assistance or durable medical equipment, something really simple. And through those engagements, we have conversations with people and let them know how we can help them coordinate other care. But yeah,
Right.
absolutely. If you don't have medical insurance, if you've never been to the doctor, if you want to switch your provider, like anything under the sun, we have been able to help with.
Fantastic, fantastic. Another one, I know about this personally because I attended, it was held at MHA, I guess a short workshop or seminar on Medicare
Mhm.
benefits, particularly for people who I went for. I'm not trying to reveal my age here and everything. I was going for a friend, okay? No, I was going for myself and everything, and it was through the PICAP, which is uh, I guess a state-funded agency, and got a tremendous amount of information. So that and I'd never even been in your offices there, and sat in your conference room and spent an hour and learned quite a bit about Medicare. I got up to speed really great. So you're a great resource there to connect. Once again, you connected me personally and a bunch of other people with the resources to learn about Medicare and get yourself all set up.
Yeah, we try to remain one of my biggest priorities in this community is being the catalyst for change, being the community organization that says yes to everything. And if even if it seems unreasonable and it's never been done before, we can't say no until we've done our due diligence to see if it's possible. So through that kind of mindset and um, I don't know if you would call it innovation, but
Mhm.
one of the things that we always do is when organizations like HiCap or WIC or the Behavioral Health Department at Mendocino County contact us and say, "Hey, we'd like to expand our services into your service area, but we don't have anywhere to do it right now. Can we use your space?" We always say yes, unless there's some kind of scheduling conflict we can't get around. But we now have a second conference room because we just expanded our physical footprint. So we should be able to say yes every time. And HiCap is one of those education sessions that we are now partnered with. We also work with some other local groups in the community. There's a women's
Mhm.
group that uses our space. There's WIC, which is going to be coming back to the community. And
Explain what WIC is for our viewers who
oh,
might not be familiar.
yeah, WIC is a service for women and children that offers stipends for things like formula, diapers, milk,
Mhm.
um, to low-income families. And
And
so
that's a federal program?
it is a federal program. So family or women and children now can access those services at our office. The schedule for that will be coming out really soon. And that'll be a monthly service. And so people who aren't signed up, who could qualify, now have an access point for that service.
Right. Let's talk a little bit about addiction, um, and just expand on that a little bit. I don't, I think a lot of viewers may not be aware of what the addiction issues or are here on our part of the coast, or I hesitate to use the word crisis. I don't know that it's a crisis, but I'm guessing one person who's addicted is kind of a crisis for that one person and
Mhm.
their family. So, talk to me about somebody, how you connect somebody who needs services for addiction. Do they come to you? Do people say, "Hey, my friend, my family member"? How does that all happen? And what types of addiction um, are you seeing? Also,
That's a great question. So we actually did a needs assessment back in 2019, where we took a real deep dive into the community by holding focus groups. We did key informant interviews with medical providers, with our staff, we also talked to family members of people experiencing
Mhm.
addiction, and we held groups with individuals who are in active addiction and learned from them what does it look like in our community. We had a survey out as well to kind of measure the rates of
Mhm.
addiction compared to
Mhm.
our population and other service areas. And we, through our work with our case management and care coordination program, had kind of started learning the depth of addiction in our community because a lot of people by word of mouth kept referring their friends to us for services. So that's kind of what triggered our work with peer recovery and addiction treatment and all that good stuff. So through that needs assessment, we learned that approximately 10% of our community is experiencing addiction, whether it be from alcohol, methamphetamines, um, fentanyl, some kind of medicated pill. Those that to us was shocking, and it's certainly higher than most rural communities. We also we took a deeper dive into regional data and data directly related to our zip code. There are certain federal reports that have to be filed by healthcare agencies and pharmacies every year. And based off of zip code data, our community, whether people are accessing prescriptions from outside the community, because there are
Mhm.
providers all over the place that our community goes to, but our community per zip code is has been ranking within the top 1 to 5 in prescriptions, opioid prescriptions,
Okay.
um, in the last, I mean, since 2017. And what that means is, obviously we have an older community.
Mhm.
That's no secret. And so there are a lot of prescriptions being prescribed for pain management, post-hospital surgeries, things like that. But there's something called the neighborhood effect. And that is what happens when there's such a high access to a certain type of drug. And in this case, we're talking about prescription drugs, that inevitably the community members around that start succumbing to addiction. So, this has been seen in other neighborhoods across the country too, where there are high rates of prescription opioids, there are high rates of addiction.
So when you say this neighborhood effect, are you saying that I know somebody who's using and perhaps abusing opioids, and I find out how they're accessing those opioids, and I say, oh, this is an easier way for me to acquire that drug, or a cheaper way, or a faster way, or just a way to acquire that drug. I'm going to do what I'm going to do what she's doing and get my prescriptions that way. And there's a number of ways to get prescription drugs that are not through a pharmacy, not through a medical provider.
Right.
You know, you can
Absolutely.
you can you know it, there's a number of ways. So am I correct? Is that neighborhood effect is like I'm sort of seeing somebody else doing that, and so I say, hey, I'm going to do that.
It's kind of a multifaceted issue
Okay,
because
okay,
we have now, let's say I come home with a prescription. Well, I have 2 children in my house and a husband.
yeah,
And that makes that prescription accessible potentially to more people in the community.
yeah.
And so we're seeing during our survey, we saw the high school students. We did several groups with youth asking them
Hmm.
about their access. Several of them reported having access to opioid prescriptions that their parents had in their home.
Wow.
Several of them talk to us about how they have parties where people just bring pills and take whatever's available. And so our goal has been to change that. Another factor of the neighborhood effect also occurs when, and we saw this happen when pharmaceutical companies got in trouble for overprescribing. And
Mhm.
then medical providers had to, because they were mandated by the state, take away access to those prescriptions, which caused people who didn't recognize that they were addicted to then go through serious withdrawal. And not everybody, but many people, started looking for pills in other ways,
Yeah, yeah.
And so
Yeah.
that's what we see. And then there's another issue with counterfeit pills, and people who are taking
Right.
methamphetamines don't know that it's laced with fentanyl, and now all of a sudden they're addicted to methamphetamines and fentanyl. And
Yeah.
so it's multi-layered. And it's something that we've been studying very closely. So we've been expanding access to support groups and one-on-one sessions to help people through recovery and connecting them to treatment, making sure they're insured and have the ability to go to, if they want inpatient services, a place that takes their health insurance. So it's a big problem. I would say our community is really, really not good at hiding it. Hiding it is not the right word. It's more that we live in this beautiful, really isolated place. And so we don't see people on the streets here like we do in Ukiah, like we do in Santa Rosa. But
Right.
that's because we have wooded areas where people stay in. We don't have we do have a lot of people who are homeless, but they go from home to home. And so
Yeah.
those are the people in our community that we really want to uplift and help them navigate how to get back to their optimal health and wellness goals.
Yeah. What you're saying is that just because I don't visibly see people in public who appear to be addicted or appear to be high or appear to be in some kind of trouble, I don't see those people on the streets or the sidewalks or at the grocery store or anywhere. Um, I've lived in San Francisco for a long part of my life, and there it's pretty easy to see people facing addiction, many of whom become homeless or whatever, and it's really obvious. It's right in front of you. What you're telling me is just because I don't see it in public doesn't mean it doesn't exist here.
Exactly.
Yeah,
And I would, one of the things I'm most proud of is watching the people that we've helped walk their journey to
yeah,
success. And I,
yeah.
I wish we could more outwardly tell all those stories because they're so beautiful.
Right.
But, confidentiality is the most
That's
important
correct.
thing to us. So,
Yeah,
um,
yeah,
that's addiction is tricky because lots of people can be high functioning and use drugs and alcohol every single day. And I think if we
yeah,
all sat down, every community member really reflected on who do I know in my life who's experiencing some level
yeah,
of addiction, guarantee you we can all come up with somebody that's living in our community.
yeah, for sure. Let's shift gears for a second. We made a passing reference to the mobile clinic, which is a new venture for you all. Tell us about the mobile clinic and what it does.
Yeah, so we haven't launched our services yet. We're waiting for a clinical license approval from the state of California, which is in process. Thank God we've been finally getting communication from them. It takes a while, but we anticipate a launch sometime in March or April. We are actively hiring for medical providers right now and medical assistants. And the idea of this program is really rooted in expanding access to services to our most remote communities. So we have
Mm,
people in Timber Cove, Irish Beach, Elk. Those individuals have to drive an hour or more in any direction to get
right.
services. And what we know based off of our needs assessment work in the community, specifically in those communities, is that people don't go to the medical office, to the doctor as often as they should because it's difficult to travel. Working families have a hard time leaving work, taking their kids out of school, all of the same stuff that I think we've all known for a long time. But our goal specifically with the mobile health clinic is to reduce the occurrence of chronic illness in our community and to
Yeah.
expand access to addiction treatment to people in those remote communities.
Tell me what's the mobile clinic look like? Is it a giant airplane, a giant helicopter that lands in my yard?
It's a 29-foot RV that was actually retrofitted to become meet the requirements of a clinic. And it's got two exam rooms in it with a phlebotomy chair and telemedicine monitors. So we will be able to do full-fledged primary care, and we will be able to draw blood work for labs. And Eventually, we'll expand into telemedicine once we have launched our services and really made our workflows streamlined and as good as they can get before we expand into telemedicine.
So the idea is I can't get to a doctor or a doctor's office or a hospital or to see a med because I can't take time off work and it's too many hours to drive, or I just think it's too much bother, or I got to worry about who watches my kids, or any number of reasons. So I can't get to see the doctor. So you're going to bring the doctor to me. Is that kind of it in a nutshell?
Yeah, in a nutshell, so we will be parked in Timber Cove twice a week. We're
Okay.
partnering with Fort Ross Elementary School,
Oh,
and
sure.
hopefully we'll be using the site of their parking lot to set up operations. We're also partnered with Manchester Elementary School, and we'll be using their parking lot for operations
Okay.
at both locations twice a week, 8 hours a day. And the hours of the day are alternated. One day starts earlier to catch people before work. One day goes later to catch people after work.
Okay.
And so the idea is that we just make it easier for the people in those communities to get to healthcare. We do have community health workers that regularly um, navigate transportation for people, whether that's providing rides or having one of our volunteers provide rides. And so that service will be available to people in those communities to make sure they can get to the clinic. But the idea is, we have a bunch of people at S&B who work at that grocery store who may or may not, or even the post office, who
Sure.
may or may not be able to leave work for 2 hours or more to get to and from the clinic. Well,
Right.
this is a solution where they can walk right down the street. Same goes for all of those teachers and staff at the school, students and families, all that kind of stuff. So.
Yeah, well, that's fantastic. When do you anticipate that? I understand you're waiting on the state to complete your approvals before you start. But ballpark, when do you think that that mobile clinic might hit the road?
I feel like I can confidently tell you guys sometime in April.
Okay,
We would like it to be sooner, but we also are dedicated. Once we hear from the state that your license is active, we're then going to have 1 full month of training for every staff member involved. We're going to
gotcha.
launch mock clinical days. So we will be asking volunteers in the community to get a script to come in as a patient and play out that script. The staffing will not know what that is
Right,
because we want them to actually work out the workflows. And so we'll do that a couple times, hold a mock clinic day, come back, really hash out all the bumps in the road, hold another mock clinical day, and do that a few times until we feel like, okay, this is ready to launch and we're going to be
right.
able to provide good quality
Yeah,
care.
you're gonna test drive that mobile clinic and the folks in it, and
Hmm.
try and get the kinks out and get everyone comfortable with how it
Hmm.
works. That's
Yeah.
fantastic. Oh, fantastic. Well, let's jump. We've got maybe a couple minutes left here. Let's talk a little bit. Obviously, the mobile clinic is in the future. What other things is MHA considering or thinking about in the future? This is maybe what would you do? What would you like to see in the next 3 to 5 years? I guess that's one way to put it. Or do you have what projects are you working on that might come to fruition down the line?
Yeah, so we're actively working on some initiatives to reduce addiction and overdose rates. We don't have a high number of people experiencing overdose in our community, but we do have high rates compared to other communities. So, so we are actually a grantee of the California Department of Public Health, both for the mobile clinic. They've provided $350,000 for us to launch this service through Assemblymember Wood is who got us that funding. But we are also part of a branch of the California Department of Public Health. It's called the Substance and Addiction Prevention Branch. And they are running a statewide overdose reduction initiative, and we are one of 6 agencies in the whole state who were selected to help them with this initiative. We're
Okay.
specifically selected because we're the only rural community that was awarded the funding. Rural communities, again, while there aren't as many in numbers as we see in San Francisco, or other metropolitan and suburban urban areas, we do see high rates of overdose and addiction. And so the idea is that under our strategic plan and activities, what we do becomes replicable for other rural communities. And so
Okay.
our team just met last week on Monday to develop a 5-year strategic plan to reduce overdose occurrence by 50% by 2030. And so the idea is to come up with a plan that can be replicated and taught to other rural communities. And you can kind of see my public health background coming out through this initiative, but that's
Sure.
part of our strategic plan. When it comes to staffing workforce, it is my goal to be the #1 preferred employer of the coast. And so we work really hard at staff and workforce culture. We do ongoing training, staff meetings, different group meetings within the organization based off department to really enrich our culture, hear from our team, incorporate their ideas into what we do. And so right now we're actually in the middle of a staffing expansion. We had 7 team members for a very long time. We now have 13. And by the end of, I would say July, August, we'll be at 24.
Wow,
And that
that's a lot of
should
growth.
cap
Yeah.
the expansion
Yeah,
for
yeah, yeah.
now.
Right.
Yeah. And then outside of that, with our mobile health clinic, obviously launching the services, making
Right.
sure we can serve Medi-Cal, Medicare, and some private insurance companies, also having grant funding to cover the cost of care for people who do not have any insurance or who are underinsured. And long term, we haven't really talked about this publicly, but I don't think it's going to be a secret for much longer. Both the Mendocino County and Sonoma County Board of Supervisors and representatives who represent our supervisors have reached out and asked us to consider expanding our service area farther south and farther north
Wow.
to support patient or people who don't get care in those places like Albion, Little River, who are just not really served by anybody's service area, and even farther south to Jenner. And so I think that is definitely something we're looking at. It's probably part of a more long-term goal, 5 to 10
Right.
years. We
Right.
have to make sure that everything we're doing right now is sustainable. And also one of our main goals this year, it's kind of a big goal. We typically draw in about $200,000 in donations from our community, but we're
Mhm.
doing a lot right now to expand access to services and medical care. And so we have a bold goal of raising $350,000 this
Okay.
fiscal year to support those services. Right now, we have reached about 38% of that goal. And
Okay.
so we have 6 months left in this fiscal year to identify donors who are willing to support our initiative. So if you know anyone
Fantastic.
out there,
Right. And if a viewer once says, "Wow, MHA is doing important work," how would that viewer donate?
several ways. Our website has a donation page, www.mendonomahealth.org. The donation page allows people to donate with a credit card or through PayPal. We accept checks to our P.O. box, which is here in Gualala. It's 1196 in Gualala. We also have received funding through stocks. We have
Sure.
one donor who donates stocks to us regularly throughout the year, which we can then sell and, liquidate.
Right.
Mutual funds, IRA donations. So really any way that somebody wanted to give us money, bequests, things like that. And all they would do if they had a question about how to do that would be to contact me directly.
Fantastic. Fantastic.
Yeah.
Micheline, this has been so informative, and I've learned quite a bit about what you all are doing. And it sounds like there's some really important, useful work. It sounds to me like you're on the cutting edge of some things for a rural area like us. The mobile clinic sounds really exciting. We're going to keep our fingers crossed and hope that April is when it happens, but I know it'll happen in due time. And I do want to thank you for your time and for sharing all this great information with our viewers.
Yeah, thank you. And just one thing I will leave everybody with is that for far too long, our communities have not believed that anything is possible. And
Hmm,
so our goal at Mendonoma Health Alliance is to show everybody that whatever we need to do here to make a healthy community is actually possible. It just takes the right group of people, the right passion, and the right amount of money that you have to
there it
find
is.
through funding.
Yeah,
But money can be found and you just have to make the right argument. So that is my long-term goal. I live here in this community and raise my children here. I have lots of family, friends that I care deeply about. And um, if we're going to do the work, why not put us on the map for being one of the most innovative rural communities in the country? So,
fantastic. Thank you so much, Micheline.
yeah,
Really
thank
appreciate
you.
it. You bet.
Yeah, have a great day.